name is Malte Gerald. I'm the country head of AGI here in Sierra Leone. Before I came to AGI, I worked as a public sector consultant in the UK and in the Prime Minister's Delivery Unit and afterwards the Department of Health in the Strategy Unit. I've had a relationship with Sierra Leone for a long time before AGI through good friends of mine, but I've always been very interested to see how I can apply the skills that I've learned as a consultant in the civil service to help governments in developing countries work better, and that is how I came to AGI. I think what makes AGI really unique is the combination of backgrounds and skills that the team brings to the work, from consulting, from the private sector, from development, from the civil service, because it's those skills and those management skills in particular that governments like Sierra Leone need to turn their vision into realities, to prioritize, to plan, to performance manage, and ultimately change things on the ground. The idea behind AGI is that really the hardest thing for governments to do is to turn their vision into reality, to implement their priorities. Now there's of course a lot of financial and technical barriers to do this and to address this implementation gap, as we call it. But what AGI focuses on is to support the country's leaders in their ability to manage their own organizations better and to deliver more effectively through those organizations. Now the way we do that is at two levels. At the very high level, Tony Blair regularly meets our partner governments and provides peer-to-peer advice. At the second level, we embed a team of advisors in the countries that we work with in their key delivery institutions. These teams live in those countries, these teams work next to their counterparts, they sit with them on a day-to-day basis. We don't have our own office, we are part of the teams that want to make change happen. I manage a team of 8 staff who are embedded in some of the key delivery institutions, like the Ministry of Health, like the Ministry of Agriculture, Ministry of Energy, as well as the Office of the President. And so a large part of my role is to make sure that the work we do really pushes forward the priorities of the government, like the Free Healthcare Initiative for women and young children that was introduced 2 years ago. Most of my week takes place here in State House, the Office of the President, and I regularly meet the President's team in the areas that we work in to support them in making a reality the priorities that they're trying to achieve. And of course I also meet with the government's other development partners like UNDP, like DFID, like the World Bank and the EU to discuss with them how we can work together on the issues that the government wants to improve. For example, their program on reforming farming, where sort of 70% of the population still depend on agriculture. Well, what is really most exciting to me is to see how some of the programs that we work on with the government are coming through on the ground and are beginning to affect people's lives. So it's the moment where my neighbor, for example, told me that she's going to take her 3 young children for a free healthcare checkup because it looked like they had malaria. Or where you drive by a new farming business center and you see the local farmer drying his rice and storing it in the facility. I think AGI's work can sometimes seem a little bit detached because we work at a very high government level. We work with central government and ministries on their prioritizing, on their planning, on their monitoring of progress. But it's ultimately those moments and those improvements to people's lives in Sierra Leone that AGI stands for.